The Return to Practice course has value for both the students and the NHS Trust supporting them. For the students, it's an opportunity to return to practice in a small, supported group to reach clinical competence. For the NHS Trust, it's an opportunity to return a nurse to the register at a time when the NHS desperately needs nurses.
A normal day on the course would start with coffee downstairs. We would then go to the lectures. The lectures were usually done by Liz, who was extremely good, extremely kind, and very patient with us. After the lectures, we would actually discuss what we'd been through. There would also be practical sessions, and there was generally a good feeling between all the people on the course. We all worked well together and helped each other, and you felt thoroughly supported all the way through.
The key thing that I took away from the course would be that when you do return to your nursing in the clinical setting, there are times when you feel a lack of confidence. But actually, as time progresses, week by week, you rebuild that confidence and realise that this is a job that you did in the past and this is a job that you can do again.
I would advise anybody that's considering returning to practice to look into it carefully and do it, because there's so much support there for everybody. Working on the ward, everybody was very, very supportive about me coming back. If you're older, there's a lot of us that are all older, and you're supernumerary, so make the most of the experience and soak it all up like a sponge.
We also have nurses who successfully completed the course who now hold senior management positions, and it's a privilege to be able to return them to a Band 5 and higher role.
The course has prepared me extraordinarily well right from day one in terms of the Brookes intervention and support and preparation, right through to the mentoring and the clinical placement at all stages. I felt incredibly well supported, and I've come out of the course, I think, really very well prepared for work.
There are multiple roles that are now available that were not available a number of years ago. So there are so many opportunities for nurses, not just only to work within the hospital setting, but in community and in specialist nurse roles. It really has been a fabulous career choice for me to come back, and I'd highly recommend it.
We're all nurses. Once you're a nurse, you're always a nurse. That doesn't change. It's something that's inside you. That was the best thing for me.